We know that within our healthcare system, there is an enormous separation between what is seen as mental health care and physical health care. And so the Mind and Body programme at its very core is about trying to help bridge that gap so that if you are a healthcare professional working in a traditional physical healthcare setting, you start to feel more confident in dealing with patients who present with any kind of mental health issues. And the reverse being true as well, and trying to ensure that for those who work in mental health care environments, our staff feel more enhanced in their skills for dealing with any physical healthcare problems.
Mind and body care is really important because the mind and body are inseparable, and so health conditions are always interlinked. The physical health impacts on mental health and vice versa. It's important that we think about these together, and especially in the way that we deliver care to help patients obtain the best possible health outcomes.
There's quite a lot of evidence around thinking about people with serious mental illness. Outcomes are poorer in terms of their physical health. On average, they die 15 to 20 years earlier, and it tends to be from those sort of lifestyle conditions, things like diabetes, cardiovascular disease, cancers, and respiratory conditions. And then when you look at people with long-term physical health conditions, there's increased risk of developing anxiety and depression, and it can impact on people's mortality rates as well.
Traditionally, the way in which we have trained doctors and nurses is that basically after undergraduate level, and certainly in postgraduate training, people end up specialising in a particular area. And so it's quite common to find that within hospital environments, doctors and nurses in an acute or general hospital, for example, have done no mental health care training, have little mental health care awareness since perhaps their undergraduate days, and that can go on for many, many years. The same thing can happen in mental health care environments where the staff working there feel very de-skilled in thinking about offering confident care around any physical health condition, and therefore education and training in an ongoing sustainable way is supremely important in buttressing any kind of improvements or enhancements that we try around bringing those two sides of healthcare provision together.
So education and training can be really helpful in the way that it delivers mind and body care, because it gives people the opportunity to reflect on their work and get a better understanding of the different professions, services, settings and pathways that are available to people who have both physical and psychological needs.
So training such as the mind and body awareness and communications training increases knowledge and understanding of the relationship between physical and psychological health. And it gives you a toolkit to effectively support people with both their physical and their mental health needs, regardless of whether you come from a physical health background or whether you come from a mental health background. And having that sort of training and knowledge and understanding will increase your confidence and your competence in being able to effectively support your patients, and that in turn is good for patient outcomes.
So the new Level 2 Mind and Body Awareness and Communication Skills Adults Training course allows us to bring some of the learning that we'd been offering face-to-face into a virtual context. It's thinking about the interrelationship of physical and mental health in the patients that we see in lots of different contexts and how we can work together to support their care. This includes improving your confidence and competence in managing challenging clinical situations when there's that interacting physical and psychological health need. Understanding the different professions, services, settings and pathways that are available to people who have both physical and psychological needs. Increasing competence to share your own skills and learn from others. and increasing your skills and gaining an understanding of the resources available to take care of yourself in the context of working with highly distressed people.
The course describes the relationship between mind and body and how they impact upon each other. It increases the awareness of how important it is to pay attention to both how a patient is feeling physically and mentally, and it gives you the knowledge and skills to do this effectively, as well as giving you information and guidance about pathways and services to which you can direct people for more specialist support.
This new level 2 mind and body awareness and communication skills training, I think, is a really important part of the jigsaw in offering a variety of different kinds of education and training interventions to try and help people. And therefore, if you're a doctor or a nurse or a physiotherapist or an occupational therapist or any other one of the numerous professions that work in a general hospital, this training is for you. The same for those who work in mental health care settings. The training is all about trying to make sure you understand the pathways that people take to try and get enhanced care, sees them navigating numerous different organisations. And so if you're a mental health care professional, focusing very much on enhancing your confidence and competence in dealing with physical healthcare will go a long way in helping you offer better integrated care.
It's a really important introduction to the concept of mind and body working. And when we meet people, it reminds us how important it is to see the whole person. So consider both their mental, their physical, and also their social needs. And I think that the mind and body awareness training provides an excellent launch pad to help us do this.
I think it's important because it's going to take all of us, whether we are undergraduate students in different healthcare professions, whether we are postgraduate trainees or whether we've been enrolled for a long time, it's going to take all of us to try and help fix the system and try and help make the system far more integrated so that we offer much better healthcare for our patients. And the Mind and Body program is nothing more than a conduit to help all of those different people, all of the people who are our champions, all the people who support the program, all the people who are engaged to a greater or lesser extent in the program. It's about helping them be able to improve the whole system in general.
We live in an area where people are living longer with an increasing number of health conditions, and it's important that we take a patient-centred approach to their care, which takes into account their holistic needs. Often, our education and our roles don't always consider the joined-up nature of people's health and the impact on their lives. This course supports people to try out different ways of approaching patient care and to learn from one another to enhance your knowledge, skills, and confidence.
I would say that the benefits are huge because what we're trying to do with this training is to help you as a professional move down that pathway one step at a time of being able to offer much better integrated care. When our patients present to us, they present asking for help and they present with a range of different issues. And so trying to understand the extent to which any of the long-term conditions that many of us wrestle with can also impact on our mood, our sense of self, our identity, our community, our family is supremely important to helping that person feel as though they're able to manage their condition much more healthily. And therefore, this training is part of a whole series of different initiatives that I think are really important to try and make our health service work better for all our patients.
So for someone who might be interested in taking up this training and thinking about how it would help them and what the benefits are, it's a really great interactive course. It offers loads of practical ideas that you can use in your workplace, and it helps you to offer the best possible care to the people that you're working with. I think mind and body training is really helpful from a patient perspective. because patients usually spend a tiny fraction of their lives in contact with health and social care. Yet these contacts have a huge impact on how confident they feel to self-manage their health needs and how they feel listened to and supported. By taking an integrated mind and body approach to the way we speak to patients and deliver their care, we can enable them to feel heard, to be seen as a whole person rather than a health condition, and to support them to have the best possible quality of life.
If I or any friend or member of my family need to go in front of a healthcare professional, whether a doctor or a nurse, what do I want from them? I want that professional to be able to offer that best, holistic, integrated, wholesome care. I want them to see every component of me. I want them to see every component of my family, so that they're able to acknowledge and understand that when someone is in pain or experiencing a whole range of other symptoms, that it doesn't just impact that one particular organ or that one particular part of the body, it impacts on their whole way of living. And that we as healthcare professionals should be there attempting to offer support and help to help that person manage all those components of their problem. And it's not just a nice thing to do. We know that if we do that, we actually do lots of other things as well, including saving money and making the system work more efficiently. So it's not just a nice to have. I think at this point in time, in the way that we're running our healthcare service for the benefit of our patients, it's an essential thing to have as well.